I'm Zoe Clark. I'm Senior Self-Management Programme Officer here at NASS. I'm also a healthcare professional and I've had Axial SpA for about 10 years now as well. And I'm delighted to be joined today by Noel, who's an occupational therapist. Hi, Kathy, how are you?
Hi, fine, thank you. Pleased to be here. Thank you for inviting me.
Yeah, thank you for joining us. Based on the number of questions and comments we've got leading up to the session, I think it's going to be a really popular session and very useful for people. So thank you for your time.
You're welcome.
Brilliant. So for anyone who's not watched our lives before, if you're not able to join the whole session, then you can come back to our Facebook page afterwards and catch up on the video, and we'll also pop it on our YouTube page and our webpage, My AS My Life. And any sort of resources that we talk about today as well, we can pop links to those in the comments after the session as well. So as I said, do pop your questions and comments in the chat. I can see we've got Claire joining us from Cornwall. So hi Claire, thanks for joining. Wonderful. So I think before we get started, Kathy, do you want to tell us a little bit about yourself?
Yeah. So my name's Noel. I'm an occupational therapist and I work at the Norfolk University Hospital here in Norfolk. And I've worked in the rheumatology team since 2004. And during that time, I also worked for a few years in the hand therapy team as well. I first worked in rheumatology back in the late 1980s and I was very first qualified and I was on a rotational scheme as a junior OT. And I've seen a lot of changes in the rheumatology world in those years. Back in the 1980s, I worked in a hospital where people were admitted as inpatients for all their different inflammatory type conditions. And this is really because the medications were not what they are today. And unfortunately, people were treated very much more symptomatically. They didn't have the DMARDs and the biologics that are available today. So it was much more of an inpatient role, whereas nowadays, all our patients are treated as outpatients and they have good medications, which enables them to lead, for many of them anyway, very normal lives, which is very good news for everybody.
That's fantastic. Well, you must have seen a lot of changes in that time, and gives a lot of hope to people as well with the number of treatments that are now available and still growing as well.
Yeah, absolutely. And it's really good when we have people come to see us with an inflammatory condition who've got a history in their family, and perhaps those people, relatives, grandparents back in the day wouldn't have had access to such good treatments, and maybe they didn't do so well, and it can be quite scary for newly diagnosed people to think about those people who perhaps struggled in life. But it's good that we can reassure people today that things are very different.
Absolutely. And so today we're going to be focusing and talking about hand pain and how you can manage that pain. So for anyone who's watching, do pop your questions in the comments. We'll have time for a Q&A at the end. Obviously, Kathy won't be able to answer really specific clinical questions, but if there's anything like that, then we can share any resources afterwards as well and answer those in the chat too. So I think a good place to get started perhaps would be if you want to just explain why some people with axial SpA experience hand pain.
Yeah, it's an interesting one, isn't it? Because obviously some people do and some people don't. And I don't think there's one cut and dry answer to that question. However, there is a close link between axial spond and also peripheral spondyloarthropathy and psoriatic arthritis, all of which are inflammatory conditions, and they do have symptoms that can cross over. So it could be if you have a diagnosis of axial SpA, you may have also some symptoms from the other two conditions, which can involve peripherals such as your hands and feet. There will be other factors that will influence as well, such as genetics and environmental influences. So your family history and what you do in your life, such as your work-related tasks, other occupations that you might be involved in. But also there are other conditions that can be a factor, especially as people age. You can start to have other conditions come into play, such as osteoarthritis, which can commonly affect the hands, especially in women as they get to middle age and older. The inflammatory conditions can always carry the risk of carpal tunnel syndrome, so that's something we see quite a lot of in combination with any of the inflammatory conditions, including rheumatoid arthritis and the psoriatic arthritis, as well as axial spond. And then there's other things such as repetitive tasks that can cause repetitive strain injury. So we see people coming through with soft tissue injuries or soft tissue repetitive pain from tasks that they're doing. For example, if you're working in an office and you're spending hours typing, or if you're working in a very physical job, such as a building trade, you might be doing quite repetitive tasks with your hands and wrists, and that can cause problems as well. So it may well be that the peripheral pain that someone's experiencing could be related to the axial SpA diagnosis, but it could also be related to another condition.
That's really helpful, because I think it's easy when you do have a long-term condition like axial SpA, as other new symptoms that crop up, we tend to put down to that condition, but it's really important to remember it could well be something completely unrelated.
Absolutely. And I think if something comes out of the blue, it's always worth getting it checked out just to see, and then you can get the right course of treatment to get a good pathway of managing whatever the condition is.
Absolutely. And talking about sort of getting things checked out, which healthcare professionals can help if someone is experiencing hand pain?
Well, I think if it's somebody experiencing new hand pain, it's probably worth getting it checked out by a doctor, such as your GP, or if you're having a rheumatology review, it's worth mentioning just to see whether it is the axial SpA or whether it is a different condition such as OA. It may be that a scan would be helpful to actually confirm what's going on there. If it's something that's not new, that you've had for a while, then you might need to get a re-referral to somebody like an occupational therapist in the rheumatology team, or a hand therapist, or it may be a physio that could help with teaching you management techniques for whatever the condition has been identified as. Equally, if it's your axial spond, it could be that you've got a flare-up of your disease and it's worth seeing your rheumatologist to get that disease management checked out, whether your meds need reviewing and so on. Or maybe you've got access to a rheumatology nurse practitioner that specialises in your condition that you can call. I know at our hospital we do have rheumatology nurse practitioners, and there's an advice line that people can call if they have flare-ups and would like further information. So there's probably a variety of routes that you can go along, but I think it's always worth getting new pain checked out.
Absolutely. And yeah, it's important, as you say, to check with your hospital and your rheumatology team how you can access help in between appointments, and who best to speak to, because it does vary in different areas, doesn't it?
It does. I think service provision is very different. I do know that some rheumatology teams across the country don't have an occupational therapist. They may not have a physiotherapist, and yet others are very well served with both, or there might be a specific dedicated hand therapy team. So I think it does depend where you live as to what service provision is and who would actually provide it.
Mm. And are there things that someone can do at home to help ease their hand pain as well, before we move on to kind of what an OT can do to help?
Absolutely. So most people find that they don't have pain all of the time. They might feel like they do because that's what they focus on. But what I'd encourage people to do is think about the times when actually maybe the hand or wherever the pain is isn't actually hurting, and think about what's different at those times. It might be that you're busy doing something, so you're distracted. It might be that you've got your hands in hot water doing your washing up and it feels a bit better. So it's worth noting that heat might be helpful, or it might be that cold helps for you. It might be that you go for a walk and get a bit of exercise, get your blood flowing, and that can make a difference to how you're feeling with your hands or any other part of your body that's painful. I think it's worth trying to get a toolkit of strategies together to help you manage, and I'll be talking a bit more about that as we move forward with this conversation today.
Oh, that's fantastic. Thank you. And are there some sort of practical things, like I know when we chatted before, we were talking about things like compression gloves and TENS machines and things like that. Is that something that an occupational therapist would help with?
Absolutely. I mean, once you've been referred to us, we would do a full assessment with you. We'd look at your hands very specifically and note what range of movement that you have, what grip strength you have. Often people find when they've been having hand pain that they actually start to lose the ability to grip things as tightly because the muscles just don't feel so strong anymore. So we would test that as well. We would look at swelling. We would look at any potential changes in the position of the joints, whether there's any disfigurement that's gone on through the inflammatory process. And then we've got a baseline from which to work. And from there, we've got lots of strategies that we would draw upon to help manage those situations. So for swelling, yes, some compression gloves might be useful. For painful joints in the hands, some splinting options might be useful. We do a lot of splinting. We use ready-made splints, which are available to us, but we also do a lot of custom-made splints using thermoplastic materials. And those are the splints that can be custom made for people that will fit really well, that can really suit the task that the person's doing. So for example, sometimes I see people who need to mobilize with walking aids. However, they find it's difficult to put any weight through their arms and hands because they've got pain in that area too. And obviously, if you're taking weight from your legs by using crutches or sticks, that weight is then going to be transferred into your upper limbs. So we sometimes would make a splint that will accommodate holding a crutch at the same time, because if you just make a splint that didn't need to be held on a crutch, it might be uncomfortable and dig into the palm of the hand. So if someone were to bring that crutch into the hospital when we make the splint, we can mold it around that situation. Same if someone's mobilizing using a wheelchair and they have to push the wheels, so we can custom make splints in that way. We also use kinesiology tape quite a lot these days. I don't know if people are aware of what that is, but if you watch any sports on the telly, you might see footballers, tennis players with bits of tape stuck to different parts of their arms or legs, and that's kinesiology tape, and we use that quite a lot now as an alternative option to splinting. It's less bulky, but it does a really good job of supporting the muscles. It lifts the skin and gives a little bit more space under the skin for fluid exchange. So the nutrients can be carried to the muscles, the toxins can be removed from the muscles, and it can be helpful in taking down the swelling in that way as well. So quite often the kinesiology tape can be a good alternative to splinting. Yeah, so those are the sort of practical things we might do to actually apply to the hand. Shall I talk a little bit more about some of the other things we might recommend? You mentioned the TENS machine. TENS machines traditionally were used for people who've got back pain, but we found over the years actually they can be really useful for various joints in the body, and specifically for the hand, you can actually connect the TENS machine to a glove that's purpose designed. It has silver fibres running through it, which helps to conduct the impulses from the TENS machine around the hand. And we have found it's particularly useful for people who've got base of the thumb pain just here. It doesn't necessarily have a long carryover effect after you've taken the device off, but it can give some relief if you've been doing a task which has set off pain, for example. So I say to people, if it works for you, then maybe try it before you go into bed at night so that you can calm the pain down before you're then trying to go to sleep. So that's another option that we use. Yeah. We also teach a lot of educational stuff such as joint protection information. So that's looking at how to use your joints in a way that doesn't put undue strain on them. Obviously the hands we're using all the time, and I think it's only when something goes wrong with the hand that you start to realise how much you rely on your hands to do everyday tasks. And as occupational therapists, we're all about doing all your everyday tasks and enabling function. So we want people to be able to get themselves up and dressed, get out of the door to go to work or to go to study, to look after family, to be able to do all the leisure pursuits and activities that they want to be able to do in the course of the day. And that's what we're all about. All the things that we're going to be offering are all to enable people to do all those tasks they want to do in life. However, that involves using all of your joints all of the time. And so joint protection is about education to take the strain off those joints. And it might be that we're encouraging people to use a piece of equipment to help them do a task. So classic one, opening a brand new jar in the kitchen. Before you go to work in the morning, might be on the size of toast with some jam on it. Got a new jar of jam. Those seals make it quite challenging sometimes to open a new jar. So we'd suggest something like a jar key, which is a piece of equipment that you just use to lift the lid and break the seal on a brand new jar. Another thing we'd be recommending would be to use two hands instead of one, rather than just putting all the strain through one hand. And again, that comes into the joint protection techniques. Another one would be to increase the grip size of a tool that you're using. So if you're finding holding cutlery, holding a toothbrush, holding a piece of equipment that you need to use for work, painters and decorators, for example, using paintbrushes, rollers. If you're finding gripping is really quite uncomfortable, if you open the grip size by padding the handle with something like pipe lagging, we use that a lot because it has a hole down the middle and it comes in different sizes. That increases your grip size and makes it that bit easier to hold the item, and it's less painful on the hand. So those are what I'm meaning when I'm talking about joint protection techniques. We would spend quite a lot of time looking at what people are struggling with and how they can adapt what they're doing to take the strain off their hands.
That's really helpful, and I can see how making lots of those seemingly small changes can really add up to make a difference, both to pain levels, but also in managing those tasks when you are struggling with them as well.
Absolutely. And I usually say to people, it's not just one thing that's going to make this easier for you. It's multimodal, really. It's looking at a combination of approaches, and that can be maybe wearing a splint, practicing your joint protection techniques, looking at what's good in your life, trying to keep a positive outlook, focusing on what's working for you rather than the negative side of things. That does make it easier for people to move forward, I think.
Mm. And definitely from my experience of seeing OTs, it is that kind of whole person and whole life kind of focus as well, you know, not just talking about where you've got the pain, but yeah, kind of how you cope, you know, mentally as well as physically, which I think is important when you're living with persistent pain.
It is. And we do quite a lot of talking about the physiology of pain and how we experience pain. There's a lot of research going on these days about pain and how we experience it and how our systems can get a bit tuned up to the pain, and then exploring ways of trying to turn down some of those messages that are going to our brains, carrying the pain messages. And it's not an easy thing to do, but there are ways of doing so. And I think what we know is that if people understand pain, that it's there to protect us, and they understand why it's there, how it works, they find it much easier to learn to manage it and live with it. And they can find strategies. And as I mentioned earlier, getting a toolbox together of strategies to help with managing that hand pain. If you have a flare up, you can go to that toolbox and remind yourself of those strategies. And some people find having a list somewhere of things that work for them is really good. Some people find having a box with physical things in it actually makes a difference. Because when you're actually in a lot of pain, in a flare up, it's quite hard to see the wood for the trees, isn't it? It's quite hard to know where to start. Whereas if you know you've looked after yourself ahead of time by planning that toolbox for when you have a flare up, you know you've got that to go to. And it might contain something like some kinesiology tape, it might have a splint in it, it might have a wheat bag that you put in the microwave to warm up to put on your painful hand or any other part of your body, come to that. And it might have a book, it might have a bar of chocolate, anything that makes you feel a bit better while you're in a flare up. You might have a telephone number of someone to ring, you know, a professional or a friend that you know you can talk to when you're not feeling so good. So I think self-management strategies should always include that toolkit of managing your pain when it gets worse.
Absolutely. Yeah, I definitely advocate the flare toolkit because, as you say, when you're in the middle of that flare of pain and perhaps getting the brain fog as well, it's so easy to forget some of the really simple things that can make a really big difference and add up to help with the pain. So it's great when you've got that go-to place to give you that reminder of what can help.
Yeah, yeah. Another thing that we would look at, certainly with the hands, is looking at some hand exercises. And we talked earlier about the fact that people might have got a bit weaker with their hands. When you have pain, that kicks in and it just stops you from being able to use the muscle sufficiently. And over time, the hands can become quite deconditioned. But if that disease process is then under control and the pain is reduced, that's the time when you can really start to try and work on strengthening the hands. So we also do some exercises where that's slightly where we cross over with physiotherapists. We don't do exercises for the rest of the body, but we do for the hand. So we might do some range of movement exercises, which are ones where you're just isolating joints and moving them independently, all in groups, such as I'm showing you now. And we might also do some strengthening, which is going to involve some resistance work, working with some putty, or maybe working with items around your home that you can squeeze or pinch. And we would test somebody's grip strength before we started this process, and then we can retest as we move along with the treatment. So, and it's usually really encouraging for people to find that actually their grip is improving. So it's good to have that figure to show that we've gone from, say, 6 kilograms in the right hand to 12 kilograms just by doing some squeezing and pinching exercises. And obviously that really helps to improve function.
Absolutely. And it's really good, as you say, it's having that motivation, isn't it? Because sometimes it can be hard to commit to doing exercises regularly. So when you start seeing those improvements, it gives you that added motivation to keep going as well.
Definitely. And when you're improving very gradually, you don't necessarily notice that you've made an improvement. Often people will come and see me and they'll say, no, I don't think of any better. And I'll get the gauge out to test, and we'll find that actually they've gained quite a few kilograms strength. And they're quite surprised, but also really pleased. And I just think that gives a boost, doesn't it, when you can see progress.
Absolutely. See your hard work paying off.
Yes, I agreed. Yeah.
That's brilliant. I think the only thing we haven't mentioned that we chatted about in our discussion before going live was one of my favourite things, the paraffin wax bath. So I don't know if it's worth mentioning that. I know it's not available everywhere, but you're just mentioning it.
Yeah. Well, the wax bath is very helpful in warming the soft tissues of the hand, and it's different from using other modes of warming the hand in that you put your hand into the hot water, sorry, not the hot water, into the hot wax, and it will coat each finger individually. Whereas if you go into a wheat bag or use a hot water bottle, obviously it's not getting quite around all the intricacies of the fingers. And so what we do is we dip the hand into the hot wax probably 3 or 4 times to build up coats of wax, and then we pop the hand into a plastic bag and wrap it in some towels to keep the warmth in there. And the benefit of doing this is it could really relax the soft tissues and allow them to be a bit more flexible. So when you then start to move the hand, it usually feels a bit less stiff. It can help with pain as well. And so sometimes people will try out the wax bath with us, and then they might go and buy one for themselves to use at home. The only thing I would say about having one at home is just to be aware it does take many hours for the wax to melt. So we actually leave ours on at the hospital 24 hours a day. We never turn it off, except when we change the wax, obviously. But so if you were to use one at home and you didn't want to leave it on all the time, you'd need to really be switching it on about 8 hours before you want to use it, which is doable. So if you were going to be doing some physical work where you're going to know afterwards your hands are going to be painful, if you pop the wax bath on in the morning, then by the evening it would hopefully be ready for you to use. So it can be help with stiffness and also for pain relief. And it makes your skin really lovely.
Feels like real self-care, doesn't it?
Oh, it does. Well, some people go for a manicure and they have a hot wax treatment as part of that, and that would be, in that setting, probably more about the skin, but it does leave the skin. So if you have dry skin, it can really help with that as well.
Oh, that's brilliant. I think that's covered everything we wanted to kind of chat through. Was there anything else you wanted to mention before we answer the questions that we've had through?
I think I probably have covered it in a sort of a global way, the sorts of things that we do. I didn't mention that we also look at larger equipment in terms of managing, but I think that's less likely when we're talking about the hands. But I think people know that OTs do raise toilet seats and grab rails and that sort of thing. But that's less of a deal when you've got hand issues.
That's brilliant. Thank you. So yeah, thank you to everyone who for sending your questions in beforehand. And if you're watching live, please do pop any questions you've got in the comments. We've got about 5 minutes left for some questions. So one of the questions we had through was asking about ganglions, and if ganglions are common and if they need to be treated for everyone who experiences them.
Yeah, I came across ganglions probably more when I was working in the hand therapy team. And in the hand therapy team, we dealt with people who were having surgery and trauma. And sometimes we'd see people who had ganglions removed. I don't know that they're particularly related to having axial SpA, sorry. It might just be something that's coincidental, like we mentioned earlier. It's possible to have several things going on at once, isn't it? And often ganglions are there and don't cause a problem, but if they do start to become painful or are impinging on your function, then definitely get some attention. And sometimes they can be surgically removed or dispersed in some way. I'm not quite sure how they do that, but there are treatments available. So if it's bothering you, I would say get some help with it.
Oh, that's brilliant. Thank you. And someone also asked about any exercises they can do for their hands. Is there any way you can signpost people to?
Yeah, absolutely. If you look at the Versus Arthritis website, that's an organisation a little bit like NASS looks after people with Axial SpA. Versus Arthritis is an umbrella organisation for all the different rheumatological conditions, and they have a nice series of videos on exercises for different parts of the body, and there's a sort of 10-15 minute video on hand exercises which are being demonstrated by a physiotherapist with somebody there who's working as a patient, and they're quite nice to follow. They're quite gentle, they're not resistant, they're more range of movement exercises. What I would say though is always be careful not to make your pain worse if you're doing exercises without somebody guiding you through them. Work within your pain limits, and that might mean doing less repetitions than you start out doing. It might mean not moving the hand quite as far as you started doing. So if you're asked to make a fist and you can't get into a full fist, but you can get to this point, then just go to that point, and you might find gradually you can work down into a fist.
Oh, that's brilliant. Thank you. And we'll pop the link to that video in the comments as well after we finish the live, so you'll be able to head straight to those exercises. And the other question we had in was any advice for people with pain between the base of the thumb and the wrist? Would that be kind of the general advice we've chatted about already?
Yeah, I think you can draw on lots of the different things that we've talked about this morning. I would say base of the thumb is often going to be osteoarthritis. That's a classic place, just where the thumb meets the wrist there. And we often do splinting for that to support while you're doing activity. So when you're in function, gripping, then you can wear that splint to try and help reduce the load on that joint. But also some thumb exercises can be helpful. And again, if you have a look on the Versus Arthritis website, you might find there's some specific thumb exercises there. If not, you can get a referral to someone like an occupational therapist or a hand therapist for some advice there. But just drawing on the joint protection things I mentioned earlier, gripping is likely to be impacted by pain at the base of the thumb there. And so increasing your grip size of things that you're holding will make a big difference there. And trying to use two hands rather than one hand, not carrying things in that grip like that are heavy, pop them on the forearm or on your shoulder, so you're taking the strain off. So those joint protection principles in combination perhaps with a splint and some exercises would perhaps be a good place to start.
Oh, that's perfect. And that is a great tip, having the bag on the arm rather than in the hand. It's so easy just to kind of do what you're used to, isn't it? And then feel it
I think,
afterwards.
yes, we are very much creatures of habit and tend to do things how we've always done them. So it can take some time to learn to do things a little bit differently. So I always say to people, don't be hard on yourself if you can't make changes straight away. I wouldn't expect that. I think it's a gradual adaptation. And often people have already started to make adaptations to the way they do things because they've learnt the hard way that doing it in the old way is painful.
Mm. That's brilliant. Thank you. And we've had a comment come through from Claire. Claire has asked an interesting question. Are hand exercises specifically for increasing strength and movement, or should they reduce pain as well? Might be a
Yeah,
physio question.
no, that's absolutely fine. So in increasing strength and movement, the idea is that pain is then reduced, because if you can strengthen the muscles that support the painful joint, it takes some of the load off the joint because it's got a good support around it. And we would always encourage that rather than resorting to splints, because splinting is just doing the same job from outside of the body. Whereas if you can build up your own muscle strength, that's what the muscles are there for, as also to help you move, obviously, but they are there to support the joints. So it should help to reduce your pain.
Oh, brilliant. Thank you. And yeah, we've not got any more questions coming through on the chat, so got a couple more minutes if anybody wants to get any last minute questions in there. Was there anything else you wanted to mention, Kathy, before we sort of finish up?
I would say, in my experience, the people who do the best in life when they have a painful condition are those that try and have a positive outlook and try and keep themselves as active as possible, working within the range that they can manage, so they're not giving themselves too much pain, but still trying to do what they can do and maybe changing the way they do things. I think those people are the ones that do best.
Absolutely. And it's been really good getting your insights on how we can adapt things. And yeah, and I think something that people quite often aren't aware about is the benefit of seeing an occupational therapist. So,
Yeah.
if you've got one in your area, it's well worth seeing them if you're struggling with activities and learning how to adapt them and keep active, as you said.
Absolutely. And you can get a referral to see an OT either via GP or from the rheumatology department, as I said, depending what services there are in your area.
That's
But
perfect. Thank you.
often the hardest part is admitting that you actually need some help. But once you got over that hurdle, asking for some help, it's all about enabling people to be more independent, not to be less independent. And I think that's the hurdle that people sometimes have to get across before they can ask for that help.
Absolutely. And I think particularly if anybody is new to Axial SpA who's watching today, it can feel like a really big step then because you're still in that process of understanding and accepting your condition. So yeah, it can take time. So it's really nice to recognize that, definitely.
Yeah. And we're there to support people with the diagnosis. And sometimes people aren't ready to accept help for a few months until they've actually got their heads around the diagnosis. But we're there to support every step of the way. And being holistic therapists, we're there to support with mental health and with physical health. And we know that they're very entwined. You can't separate.
Absolutely. And I've just seen a last minute question pop in. This might be a bit too clinical. It might depend on their advice. But Claire's asked that OT have given a wrist compression support and they said to wear it all the time. But she said, I don't, I just use it when doing heavy work, as I assume long term this would make my wrists weaker. Do you have any thoughts on that?
Yeah, absolutely. I think Claire's in the right zone there. I would say use splints when you need them and take them off afterwards. I personally never recommend wearing a splint all the time. If it's a functional splint, I recommend wearing it for the task where they need that particular support. And I nearly always give exercises alongside the splint. So you're not learning to rely on the splint, but at the same time, you're also strengthening your own splinting support from within, as we mentioned earlier, with strengthening the muscles. And it might be you get to a point where you don't need the splint anymore.
That's fantastic. Thank you. So yeah, I think we'll finish up there. But thank you so much, Kathy. That has been really fantastic and covered a big amount of information in a small amount of time. So I can tell it's going to be really helpful for people watching on catch up as well.
You're welcome. Thank you for inviting me to join.
Oh, you're welcome. And I'll just let everyone know that the next session is going to be on Thursday, the 23rd of February at 6 p.m. And we'll be joined by Josh Poole, who's a physiotherapist. You'll probably recognise him from his previous sessions. We're having another high intensity interval training session where he'll be demonstrating the exercises standing and I'll be demonstrating them seated. So come join us for a nice workout if you'd like to, or as always, you can watch it on catch up as well. We've got some lovely comments coming in for today's session. So thank you so much, Kathy. And thank you everyone for getting involved as well.
I'm glad to help.
That's brilliant. Take care, everyone, and see you next time.
Bye.